A patient walks into the ER with very concerning symptoms, including vomiting, headaches, and lack of appetite. The patient has diabetes and reports trouble controlling their symptoms. After further examinations, you discover that the patient has a much slower respiratory rate, and the urine test indicates an elevated anion gap and larger concentration of H3O3 in the urine. What would your diagnosis of this be? Metabolic acidosis, a serious buildup of acid in the blood that can be caused through the production of acid or because the body can't remove it. While there can be a lot of causes for acidosis, some of the most common are excessive HCO3 loss, renal failure, and diabetes caused ketoacidosis. Metabolic acidosis refers to the fact that there was a problem caused by a decrease in the HCO3 minus. Normally, blood pH depends on the balance or ratio between the concentration of bases, mainly bicarbonate, which increases the pH, and acids, mainly carbon dioxide, which decrease pH. The blood pH needs to be constantly around 7.35 and 7.45, and in addition, the blood needs to remain electrically neutral, which means that the total cations must equal the total anions. Another topic to understand is osmosis. Osmosis is basically the balancing of water to equilibrate and have the same concentration. In our example here, we see that on two sides of the tube there are two different concentrations, and water travels from the less concentrated to the greater concentrated side in order to have these two concentrations be equal, and that is osmosis. Using the properties of osmosis, we can also draw our Darrow-Yannet diagrams. Here we have, on the y-axis we have the solute, and on the x-axis we have volume. And the extracellular fluid and the interstitial fluid is very similar in both of these, as they equilibrate to have the same osmolarity, which is defined as number of moles over volume. The kidneys have two main ways to maintain acid-base balance. Their cells reabsorb bicarbonate HCO3 from the urine back to the blood. They also secrete H+ ions into the urine. By adjusting the amounts reabsorbed and secreted, they balance the bloodstream's pH and can prevent blood acidosis. Here, if the pH does change, this is a system that will eventually revert it back to equilibrium. In the blood, there are an equal amount of anions and cations. Not all the ions are easily or convenient to measure, so typically the dominant cation, sodium, and the two dominant anions, chloride and bicarbonate, are measured, and the rest are unmeasured. This difference is called the anion gap, and accounts for unmeasured anions like organic acids and negatively charged plasma proteins like albumin. Metabolic acidosis can be broken down into two categories, based on whether the anion gap is high or normal. In the first category, the metabolic acidosis is a high anion gap, and here the bicarbonate ion concentration decreases, and this is often caused by organic acids accumulating in the blood. The second type is the lower gap, or the normal gap, and this is often caused by severe diarrhea, as well as type 2 renal tubular acidosis. Here, the HCO3 is replaced by the Cl- that is secreted, and even though the anion gap is normal, there's a larger amount of chlorine compared to carbonate. Next, we'll move on to our problems. In the 19th century, cholera epidemics plagued large industrial cities traveling through contaminated water. Some of the most dangerous symptoms of cholera are severe diarrhea, dehydration, and metabolic acidosis. Benjamin is living downtown London during these difficult times and catches cholera from the infected well next door. Please answer the following questions about poor Benjamin, pictured here. A. We know that diarrheal stool contains higher HCO3 concentrations than plasma, and that excessive diarrhea occurs in patients in cholera. Explain how Benjamin's excessive diarrhea caused by cholera can lead to metabolic acidosis. B. What is going on in Benjamin's body in response to metabolic acidosis? What systems are in place, and how can it bring the body back to equilibrium? C. Suppose Benjamin had access to a time machine and traveled to the current day. What treatments can he take, and what are the risks of such treatments? So for part A, we want to look at the equilibrium reaction between H2CO3 bicarbonate to H plus and H2O3 minus. So H2O3 minus decreases due to the increased loss of H2O3 in the diarrhea. This causes a rightward shift of equilibrium, which creates acidic conditions. And these acidic conditions are what causes metabolic acidosis. And for part B, we want to look at the response to metabolic acidosis. And there are two major factors that come into play, which are the renal system as well as the respiratory system. So as we see, initially, the partial pressure of CO2 is 40 mmHg. And diarrhea causes a significant loss of carbonate ions, which create a shift from A to B. And we can quantify this change in pH using our equation as pH equals 6.10 plus log of concentration HCO3 minus over 0.0308 times partial pressure of CO2. And plugging in the values we have at B, we get a pH of around 7.123, which is very acidic. Next, due to the acidosis, the respiratory system kicks in to try to fix the acidosis. And it increases pH slightly through increasing PCO2 by slowing the respiration rate. This is also called hypoventilation, and this decreases the CO2 excreted, increasing the PCO2, and shifting our point from B to C. And using the same equation as above, we now substitute new HCO3 values as well as PCO2 values, and we get a pH of 7.106. And although the pH doesn't change very much, it's significant because the CO2 changes, which allows for our final shift. So lastly, the kidneys come into play. And the kidneys are very slow response and take often days, not hours, to fix the system. And they utilize renin and angiotensin II to increase your absorption of HCO3 and increase excretion of acids, which decrease the pH. And this final step brings it back to equilibrium. And lastly, for part C, we're looking at the treatments for acidosis. And the primary one is sodium bicarbonate. So we can fix the acid imbalance by shifting the equilibrium left to bicarbonate by increasing the concentration of H2O3 minus. By increasing the H2O3 minus, we decrease the H plus as a side effect, and this will decrease and hopefully fix this acidosis. On the other hand, overshooting with the uncertain amounts of NaHCO3 can cause Na overload as well as excessive decrease in the proton concentration, which can lead to basic conditions, also known as alkalosis. And both are bad, so we want to make sure you have a good balance of it in order to treat Benjamin. And that concludes our presentation on metabolic acidosis. Hopefully you've enjoyed and have a great day. Thank you.